talk about apnea test today. So apnea test is the test used to diagnose brain death in patients who are apneic and in a state of coma. Now, before doing an apnea test, uh, there are some prerequisites that we have to make sure that the patient systolic blood pressure is more than 100 millimeters of mercury. There's no hypothermia. The patient should be euvolemic. CO2 levels should be baseline, and there should be absence of hypoxia in this patient. Now, after these prerequisites are filled, we have to prepare for apnea test. We do that by adjusting the ventilatory rate of the and tidal volume of the ventilator so that the PaCO2 levels are between 35 to and 45 millimeters of mercury. Then we oxygenate the patient with 100% of FiO2 for at least 10 minutes so that we have a baseline in a baseline ABG a PaO2 of more than 200 millimeters of mercury. Also, it is beneficial if the patient has an arterial line, so that during the apnea test we can do a continuous blood BP monitoring, and we can take repetitive samples for ABG. When we conduct this apnea test, the patient's chest should be exposed so that we can identify any spontaneous breaths the patient is taking. After this, we disconnect the endotracheal tube from the ventilator, and we connect a nasal cannula tubing which has oxygen coming at 6 liters per minute and insert it into the AT towards the carina and leave it there. Now we look for spontaneous breathing for the next 8 to 10 minutes while making sure that the patient does not have a loss in oxygen saturation and his BP stays stable. After 8 to 10 minutes, we take a sample, and if the PaCO2 level is more than 60 millimeters of mercury in this ABG and the patient has not had any spontaneous breathing, then this apnea test is positive. If CO2 has not reached that threshold of 20 millimeters mercury above the baseline, or it is still less than 60 millimeters of mercury and patient is stable, we can continue apnea test and assess further ABG still this PaCO2 levels are reached. Also, if during doing this apnea test a patient desaturates, you have to stop, you have to abort your apnea test, and also if there's hypotension, you have to abort your apnea test. Thank you.